This is the Think Again podcast. I'm Scott Jens, your host, and today's episode is titled Complete Commitment to Patient Education. Our guest is Dr. Pam Theriot, Clinical Director of the Dry Eye Relief Center at Lusk Eye Specialists in Louisiana. She's also on the Public Awareness Committee of the Tear Film and Ocular Surface Society and has written a blog and a book to help the public become better informed about alleviating dry eye. And she is committed to patient education. Dr. Theriot, welcome to the Think Again podcast.
Thanks so much for having me, Dr. Jens. I'm so happy to be here and share a little bit of my journey with you.
We're excited about it. Right, doctors work with a varying degree of effort and impact to educate their patients. I've seen this live. And you take on a role of trying to educate the public broadly. What would our audience need to understand about educating their patients that doesn't always land with the patient? Because I can tell you know that there's some things we're doing that aren't effective.
Right. So I went on this journey about 7 years ago when my husband, he's in the military, and we had moved city to city to city to city. And I was really sad about the patients that I had developed and become close with, and I was always having to leave them. And I thought, what if there was a way for me to see my favorite patients regardless of my zip code? And so I started on the journey of writing a blog so that I could reach them and they could learn from me, even though we weren't down the street from one another anymore. And that's where it all began. And from the trying to start a blog actually came the book, because I thought it was easier to write a book than to start a blog at the time. I may be a little bit technologically challenged. And so I wrote the book, and then the blog came from there. But that was the idea, was that I wanted to be able to talk to people who weren't next door to me.
I mean, that's super interesting. Again, I don't think you've ever, in my talking with you, incriminated our colleagues as not being great at education, but patients do appreciate information from their doctor. And I just think that it's fair to analyze each other, that we don't always give it the time and attention that's necessary. Is that why your patients love what you do for them so much, even after you've moved, that you kind of taken it another level?
Well, I think that one of the things I say to my patients in the room and that take my online course is that we don't have the time in your appointment to go over all of the things that I could possibly tell you to make your dry eyes better in that short appointment time. And yes, we do try to get a little bit here and a little bit there, or give handouts, or refer to additional materials that the patient can go over later. But to get that complete dry eye history and treatment plan, it really does require some outside resources. I think that's one of the things the TFOS lifestyle workshop has just uncovered, is that there's so many things in our lifestyle that really incorporated can affect our dry eye syndrome.
Yeah, and the wisdom, what I hear you saying there is, it's hard to fit it all into a normal patient encounter. So you create this journey with them that transcends the encounter. So this digital course is trying to help patients understand how they can change things and enhance their lifestyle as part of the process of that journey. Is it been better received than handouts because it's a digital course they can access on their digital devices?
Definitely. I think there's a different level for patients. Some of them want a handout where they can just go home and refer to it. The book that I wrote has a whole workbook that comes with it, so they could go through and look at all the things. And some patients want that written material, but some of them really want to dive into what's going on with them. Why does this keep happening chronically, and what they can do to control it? And so my course and the book, they mirror each other, and they go over things like sleep habits and makeup routines and contact lens best tips and wear and care routines. So it's really things that probably all of us are talking about, but it's put all together, right, in one place where patients can look at it what they think is affecting them most. If they're like, oh, I sleep fine, but I wear eye makeup every day, they can dive into that chapter or that section of the course.
I give you a lot of credit for investing as much as you have in this digital content delivery system. We know that a lot of our audience hasn't the time or the resources to do it. Maybe you would argue they do. You've just taken advantage of time and resources at your disposal. But give us a little bit of insight from somebody listening who doesn't have this. How can they improve their education process? It seems to me one of the first things you're telling me is you've got to talk about a lot of different life disciplines, not just here's a dry eye pad, put it in the microwave, use it. You seem to be really broad in the topics you cover.
Right. And so I think starting small with what you think the bulk of your patients struggle with. So maybe you fit a lot of contact lenses and you just want to give them the rules about contact lens wear. So I have a few golden rules that I talk about, which are always, always, always remove your contact lenses at the end of the day. And maybe you have a favorite contact lens solution. So you want to make sure that all of your patients are using your favorite solution because it's going to work best for them because of the climate that you live in or, whatever your outstanding circumstances are. But if you have a handout about that, okay, here's your contact lenses. These are my contact lens rules for you to get the best wear out of them and the least amount of dryness. And then you can give them a handout about that or say, I did a video and I put it on YouTube. Here's the link. You could do something. In my clinic, we do a lot of care kits so that patients can walk out with their dry eye starter kit. So I hand them a sheet of paper about the care kit, tell them that everything's available for their convenience to purchase in the office if they'd like, or they can get it online. Give them options. But if things are written down or they can refer to videos later, there's actually a couple of companies out there now that have made videos that you could just utilize in your office. Like Hoot, Hoot, they have a whole series of email blasts and videos that go along with that, or the little videos that your patients watch while they're waiting to see you. Is it Rendia? They have dry eye videos, all these kinds of things. So you can utilize these pre-made or you could create them yourself.
So to ask about how your effort to educate dry eye patients has gone into other education, you've already covered contact lenses. Obviously, those can be related. But when we even think about patients understanding a small refractive error change or ocular hypertension, do you take the same approach?
I think what starting the blog did for me was that I was very conscientious of how I'm saying things. So I may practice a speech. I might practice my words to patients and see how they react to them and then tweak it. So if there are things that we talk about over and over and over again, then I try to use very patient-centric language, analogies as far as something that they could relate to, and really don't think that the way I say it the first time is the best way of saying it, and just keep practicing.
That's really important. I take a brief moment. You and I met many years ago when we were both involved with the American Optometric Association's infancy program. And yes, the AOA had been sponsored by Johnson & Johnson Vision at that time to promote the program. And one of the things that the president of that company said to me in a car ride at dinner one night is, why don't your colleagues do a better job of telling people how impactful their care is? He said, I've gotten to the point where I just want somebody to say to me that while I look through your dilated pupil, or in this case, maybe I had a fundus photo or whatever, I can check for the signs of high blood pressure, diabetes, macular degeneration, and glaucoma. He said, just tell me 4 things, but say it to every patient. And I think that's what you're suggesting, is that we think about becoming scripted in our minds and then make sure that as you work on it with patients, you get to the point where it just drips off your tongue and it makes each of those patients feel really well cared for. I think that's a very important bit of advice you've given us. So tell me a little bit about where you are with your book and your course. You provide this to your patients, and they have a fee that they pay to get access to the course?
Yes. Yes, so the book goes through the exact same things as the course, but the course will allow them to dive a little bit deeper and to have some interaction with me as well, so they can ask questions of me, and get some one-on-one coaching. Um, so it's been really great to have both of them, because some people are do-it-yourselfers, and you can buy the book on Amazon, or they want to take a little bit deeper dive and do the course.
So do your patients mind paying a little bit for access to you? It seems like a great way for you to drive a little bit of revenue for your expertise, but also make sure you're regulating how many communications are coming to you. That's really a novel idea.
Right. I've had really great response to it, because they do appreciate having that extra time with me and just being able to, ask questions outside of
And
the clinic.
yeah, so I'm going to let you have the last word about patient communication and education. Tell us what you would advise the listeners to do to grow their efforts to inform their patients. Where should they start?
I think you should start with what you're passionate about, what you see with your patients most often, something in your clinic that bothers you, that patients come in over and over and over again. And so that's definitely where I started, and that's where I grew my golden rules. I talk about them in my book and on my podcast, that these are my golden rules. I also preach that you get one pair of eyes, so treat them like they're the only pair you'll ever have. And that's where the golden rules come from. So start with
I
your
love it.
passion.
I love that. Start with your passion. Dr. Pam Theriot, your passion for patient education is infectious, and I really appreciate you being our guest on today's Think Again podcast.
Thanks for having me.
And that's it for today's Think Again podcast, brought to you by GPN Visions, a peer-to-peer learning community to help grow your eye care business.